first I'm going to talk about the peritoneum and peritoneal cavity. The first is the peritoneum. Peritoneum is the continuous serous membrane that covers the abdominal pelvic and the viscera. So it's divided into two continuous membranes, which are the parietal peritoneum and the visceral peritoneum. The parietal peritoneum covers the abdominal pelvic wall, while the visceral peritoneum covers the viscera of the abdominal pelvic. From there, we can see here, this is the parietal peritoneum and the visceral peritoneum that lines the viscera of the pelvic wall, the abdominal pelvic. So, from here we can see there are two layers of the peritoneum when it covers the viscera. So first we can see the one that covers from the stomach to the liver. This is called the omentum, the lesser omentum. While the one that covers from the stomach towards the small intestine is called the greater omentum. The peritoneum, the visceral peritoneum that covers from the other organs towards the abdominal wall is called the mesentery, such as the transverse mesocolon from the transverse colon, the viscera, they are called the mesentery.
Next, I'm going to explain about the vascularization of the peritoneum. For the parietal, it is not stated in here, but basically there are four main arteries, which is the lumbar vessel, which is from the abdominal aorta, inferior and superior epigastric from the external iliac, deep circumflex, which is also from the external iliac, and also the musculophrenic, which is from the internal thoracic artery. Next, for the visceral, viscerals are the arteries supplying the appropriate viscera, such as for the liver, it is supplied by the common hepatic, and then the stomach, we have learned before this, and then this one, pancreas, it is supplied by the superior mesenteric artery, right colic, right external iliac, which supply the ileum, and then right internal iliac, and then there is also left common iliac, sigmoid, and also inferior mesenteric, which all supplies the large intestines. And then there is also spleen artery, which will supply for the spleen organ.
Now I will talk about the nerve supply for the peritoneum. So for parietal peritoneum, it receives the same somatic nerve supply as the region of the abdominal wall that it lines. Therefore, pain from the parietal peritoneum is well localized, and it is sensitive to pressure, pain, laceration, and temperature. So for the visceral peritoneum, it is poorly localized and only sensitive to stretch and chemical irritation. Pain from the visceral peritoneum is referred to areas of skin, dermatomes, which are supplied by the same sensory ganglia and spinal cord segments as the nerve fibers innervating the viscera.
As we all know, the cavity itself envelops the organs, and then the function, the clinical importance of it is if there's any localized pain or unlocalized pain, we can determine from the external layer, from the external of the body, to see if it's from the visceral layer or the parietal layer of the peritoneum. From there, we can derive a much better diagnosis for each patient. And then, other than that, the clinical importance of it is the peritoneal lining secretes a fluid that engulfs most of the organs, so that any kind of movement within the body itself is very much mobile, so that it doesn't really stick to each other. And other than that, if it's become infected by external sources such as bacteria and whatnot, or inflammation, it will tend to stick together, and it will form a protective layer above the organs to make sure that the organs beneath them is not affected by the inflammation at all. So that's it.